welcome to my YouTube channel. My name is Wangoi Mwangi and I'm a Kenyan Naren. I do videos on nurse education, patient teaching as well as health education. Today I come back with a health information patient teaching kind of video, and this video will be on autism spectrum disorder. This is a topic that is dear to my heart because I got my child to get this diagnosis in the last, let's say, 2 months. And when it was first suggested, I was totally freaked out because in as much as I know this information and I have the theory, being told that your child has something, even if it is a flu, you do not want to be told that they have a health concern. However, I will share a bit of that story. It is still a story in the making because I tend to believe it is too early to tell, and we are going to see why I have my doubts. But at the end of the day, the childhood specialists have been able to get and they have been able to assess the child. I have had my first, second, and third opinion. It is so important to do this, guys. And before we get there, guys, please subscribe to this channel. Please like, share, comment this content so that my channel keeps speaking and more people subscribe. As more people subscribe, the more content will get better and better, and the channel will keep growing. So on all my socials, I'm Koi Moss, just as in this YouTube channel I'm Nursing with Koi. So let's dive right in. Disorder can be defined as a group of developmental childhood disorders. Of course, it may persist till adulthood, and it is characterized by impairments in behavior, social communication, and interaction. In terms of behavior, there is the repetitive kind of tics and behaviors that a child may have. There is one that is very characteristic of lifting the hands or the fingers like this, or some funny movements with the hands especially. Then this is characteristic with autism. There could be a behavior of maybe rubbing the ears or having a certain head shake or positioning. There could be behavior, still in behavior, the kind of isolation or withdraw from the society and would like or prefers to stay alone or interact with the environment or objects more than people. I tend to believe this is a symptom that persists till adulthood for some people, and we have people who are more comfortable dealing with objects, machines, as compared to interacting with people, with human interaction. So the other common or cardinal sign, I have talked of 3 things. There is the behavior part, the behavioral aspect, the repetitive behaviors. Then there is the social communication, and this communication in terms of delay in language development. They are not saying the syllables or the cooing at the time when they're supposed to be doing this in the milestones. We have the maroon and purple book that we get for our journey as we are pregnant. That small booklet has a lot of information. So there are those milestones that are described starting from the social smile going all the way to the first ones. So if they have not achieved some of those milestones, then they would like to be watched more. You just want to keep out an eye just to ensure that as they grow a little bit older, you are able to pick more cues and you're able to explain the behavior, or you're able to interact with the child at a closer level. The other thing is about social interactions, and in that terms, they are more withdrawn, as I had mentioned. They are more comfortable playing with things. They do not maintain eye contact. They will not socialize with the people in the vicinity. So you may be the mother, but the child is just loitering and not bothered with you. If he has his favorite toys wherever they are, that is where he will go and he will just be concentrating. So if there is a certain object that they love, they will be fixated on it, but that is not always the case. So yeah, so those are the 3 cardinal or characteristics. Autism, it is still unknown. In this day and age, we do not know what causes autism, but there are several theories that actually exist regarding the causes of autism. So some include a genetic component and could be found in siblings displaying similar behavior. There could be a theory of toxic substances getting into the child system, like lead poisoning. There could be infections during or before pregnancy that cross to the child's side of the placenta, or autoimmune disorders that could lead to autism. That is another theory. And then in this case, the body produces chemicals against its own body cells or tissues, among others, and this has been associated with autism as well. So for sure, we do not know the ideal cause or the real cause of autism, but it is multifactorial. Does it go away or is it cured fully? What happens? In this aspect, the information I have found so far and from my training, it really doesn't go away. You cannot say that you are cured of autism. What happens is you get better, you train better, you stimulate the brain more, and that child grows. However, it's a chronic disorder that may last a lifelong journey with that patient, but the child can live to fulfillment and to adulthood and can be as functional as other children. Speaking of my child, in the symptoms that we had mentioned earlier, he had speech delay, but he's only 2 years. But then he only has about 5 words at 2 years. So that is a delay because at 18 months, that is 1 year, 6 months, they should have at least 10 words, 10 to 50 words. So that by the time they are 2 years, they should have almost 100 words. So if you are to check that milestone against the ideal, then you can see he's totally behind. But then since he doesn't have the restricted repetitive fixed behavior and the social interaction so far, I tend to think it's within the normal range. He is very comfortable with eye contact. He's able to identify in a pool of people. He will identify one person he feels secure with, and he will stay with that one person in a crowd. He's also able to play with his sisters, and he's able to play with other children, especially in church. Therefore, this is why probably I still do not see like he has autism. So I am trying to treat him as usually I would, because it is a process. I will get to know as we proceed, as I had said. So the diagnosis, my pediatrician, the one I'm currently in sync with, says he just needs to give him time. But he told me the time to act is now. What I need to do is actually interact with him and stimulate his brain further. This means less screen time and more one-on-one personal interaction time or human interaction time. So as opposed to having him watch some nursery rhymes on TV, it would be better you take a ball and go to the yard and have a match. He actually does love running up and down the stairs, usually walking, climbing, those he loves. So he's able to play with the bike. He's not able to ride the bike yet, but he can be able to play with the wheels. He's able to do blocks. He's able to play with household utensils. Sometimes they just drive me crazy because they are fighting over the same toy with the sister, and usually he will win because he's stronger despite the fact that he's younger, and therefore it is work in progress. Probably I will do another video of as I get further along and he gets older, I will get to know for sure, because all the people who have seen him, I have done like 3 or 4 second opinions, and they tend to agree that it is still early, and even if he has autism, it is the mild form. He doesn't have the repetitive behaviors, but since he has the delayed language development, that is what is being caught up in that whole process. However, it is a daily procedure. It's a lifelong, a chronic disorder, so therefore it's each day at a time, and try to enjoy the process as it goes. the outcome of these children with autism. Again, it is still early for my child for me to know for sure, but then we are told about 80% will have learning disabilities or learning problems. They usually benefit from special education or a system that supports or that is inclusive or people with special needs. And then the 80% will have normal, intelligent quotient, normal IQ, and excel in various aspects such as mathematics, arts, music. They can actually do exceptionally well. And therefore, I tend to think all this is a journey that needs to be taken very calmly with no panicking, no panic mode, no helicopter parenting, just going each day at a time. Then, because each child is different and some are verbal, some are non-verbal as they communicate, they need to have a routine. So occupational therapy actually does help. But before we even get to this diagnosis, there are so many things you need to rule out. For my child, I had to do several tests. I'm still running more tests because as I said, this is something very recent. It's less than a month, no, like than 2 months since I had this thing for the first time. And I have had to do several tests. And the most significant test I have found is the ear assessment. And if they find that there's, let's say, the patient or the child is hard of hearing or has hearing problems, if that is rectified, probably the delay in speech will be corrected and they do not have autism at the end of the day. What they had was hearing issues. But in the event that they are cleared in the ENT department, then it relieves the neurological side. However, when it comes to neurological symptoms, most children with autism will have cognitive function that is of varying or in a spectrum. Some will be on the higher side, they are very functional in terms of cognitive function, while others have very minimal cognitive ability or their intelligence is very, very low. However, all these children should walk that journey individualized, learning through as learners with disability or with special needs, but still in the same curriculum. So we are lucky in Kenya, we have the inclusive special needs education, and they're usually in the same class or have a class in the normal schools, but then they have a class of their own to go to navigate through normal schooling. So my baby is still young. I do not know how that will look like as they get older. How does this get diagnosed? It takes a lot of specialists to come together and work together for a definitive diagnosis to happen. I have seen a pediatrician, I have seen an ENT specialist, I have seen a pediatric neurologist, I've also seen a pediatric physician. I do not know how many more of these consultants I will see. By the end, we are going to have a definitive diagnosis of whatever is ailing. We still have pending tests. I'm waiting to get my child tested. They're going to do some acoustic and audiology tests to just ensure that his hearing capacity is there. Of course, as a layperson, I am able to tell he can hear things and bangs, but they also need to tell whether he is able to hear in the same wavelength as you and I, or there is a problem somewhere in the pipeline, because this could be affecting the delay in language development. However, I am told there is also genetics factors at play. It could be in wherever he came from, they have people who had delayed speech development or language development or communication, and eventually they just picked and continued being the normal people we know them to be. So it is a wait and see situation, guys. Red flags that you should look out to ensure that your child is checked out for ASD as early as possible. There are 4 that I would say outrightly, and that's why I had my child investigated further. First is poor eye contact, and then 2, speech development, and then regression. Then we have 3, less than 10 words at 2 years of age. So this is where my child lies. He has less than 10 words at 2 years mark. and then playing alone or parallel play. So parallel play is they will have children, but all those children are playing, or this autistic child is just concentrating on her toys or his toys, does not want to know what the other children are doing. So everybody is doing their own thing and they're comfortable that way.